Okay, good afternoon and welcome to the webinar Shifting the Focus of Health and Economic Policies, Investing for Sustainable Health and Well-being. This is the first webinar in the series which is leading finally to the 18th European Public Health Conference, which will take place here in Helsinki. There are more webinars in the pipeline on different topics of public health, and I will tell you more about those at the end of the session. So wait for that. My name is Ilmo Keskimäki. I'm a research professor at the Finnish Institute for Health and Welfare, and I will chair the European Public Health Conference this year. And I will host you during this session. As said, today our topic is shifting the focus of health and economic policies, investing for sustainable health and well-being. This investing for sustainable health and well-being is also the main theme of this year's European Public Health Conference. We addressed this topic already at the Lisbon meeting last November, and so we wanted to reiterate these issues, this topic again, and start the series of the webinar with that. On the stage we have three presenters. Otto Kyyrönen, who is coming from the Finnish Federation of Social Affairs and Health. Can we see Otto somewhere?
Yes, hello.
Yes. Okay. And Caroline Kostens from EuroHealthNet.
Yes, hello, good afternoon.
And Luigi Siciliani from University of York.
Hello, everyone.
Okay. Hello, good to see you here. So before we start, I have some housekeeping rules. First, please don't use your camera. This applies others, not of course the Otto, Caroline and Luigi. And also keep your microphone off. We will, as said, we will have three presentations, and after each presentation we will have time for one or two questions. For those questions we are using the chat window. Those who don't know Teams so well, you can find the chat window by clicking the toolbar icon that looks like a speech bubble. So after each presentations, I will pick one or two questions on the presentations, and then we have some time also for a general questions and comments after these all three presentations. And of course, Otto, Caroline and Luigi can also answer these questions during the presentations or at the chat window. So also please note that the chat is not anonymous, and your questions will be visible for everyone. So, and finally, I hope that it is all right for all of you that this webinar is recorded. And this recording will be shared later on European Public Health Conference channels, and it can be found at the conference website. So, but let's start. I have a very short presentations about the European Public Health Conference here. You can see that the conference will take, as said, will take place in Helsinki in November from 11th to 14th. And the venue is Finlandia Hall. It's very conveniently located in the center of the city. So there are three co-organizers, of course, traditional European Public Health Association, and we have two local organizers, Society for Social Medicine in Finland and Finnish Institute for Health and Welfare. As said, the general theme of the conference is investing for sustainable health and well-being. So what we wanted to underline with picking up this theme is, of course, that it's that the health is not only an expense; it is also an investment, and there is let's say payoff from that related to other benefits of the society. And so that is also the theme of our webinar at the moment. And also picking up some of these sub-themes, we wanted to let's say clarify what we mean with sustainable health and well-being and investments on them. There is the investment means, of course, that we are supporting the planetary health. We are supporting the well-being of the societies. We are trying to transform the economic and health policies towards the supporting the population health, and so these are the topics of the conference, and these are the topics of this this webinar at the moment. So then sorry, excuse me. As said, we have three presentations today, and we start with the Otto Kyrönen's presentations on well-being economy, integrating sustainability and social welfare. Then we go to the Caroline Koston's presentations on shifting the focus of health and economic policies, and we will end with Luigi's presentation on how do health and health systems contribute to sustainable development goals. So please, Otto, floor is yours.
Thank you, Ilmo. I hope you can hear me. Can someone verify that you can hear me?
Yes, I can hear you.
Great. Thank you very much. So yeah, thank you, Ilmo and Riikka, for inviting me to this very interesting webinar. I'm sharing my slides. I hope you can see them well. So my name is Otto Kyrönen, and I work for SOSTE, Finnish Federation for Social Affairs and Health. We are the umbrella organization for social affairs and health NGOs in Finland. We have around 240 member organizations, and yeah, we kind of try to protect the rights of those organizations, but also the people that they represent and help. And today, I'll be talking about the well-being economy. I think my kind of function in this webinar is to introduce the concept and discuss it through the Finnish context. And then, yeah, the other speakers will kind of dive deeper into the topic after me. But this is the structure of my presentation. So the first thing is to kind of briefly discuss the history of the concept. Then I will explain the core principles of the well-being economy. I will discuss briefly how it can be measured and should be measured, perhaps. And then I will draw some conclusions about this presentation. And just to explain, the figure on the right is the cover of our book from 2014, where we kind of launched this idea. I think we had around 25 writers in this book. Sadly, it's in Finnish, but yeah, perhaps we can do something like this in English as well in the future. So yeah, let's go to the history of the concept. So the well-being economy in Finnish, it's called hyvinvointitalous. Is a concept that we started to develop in 2011. That's when our organization was created by these other, when these other three organizations merged. And then in 2014, we published this book that I showed on the previous slide. And then after that, we have published reports every few years to kind of popularize this notion. Then in 2019, we had a government led by the Social Democrats, and they included this notion in their governmental program. And that's when it started to really spread within Finland. And then Finland held the presidency of the European Council in 2019. And we were able to kind of make that idea a central part of Finland's presidency. So that's when it kind of reached the global stage. And then after that, in 2021, the Minister of Social Affairs and Health in Finland appointed a steering group to create this kind of a steering model for policy making based on the well-being economy. And yeah, then there's been many reports after that in Finland. And in the 2010s, this notion also became more popular around the world. The OECD published a report and some other organizations. But this is basically the brief history. I'm sure that in other countries there's these different histories, but this is at least the understanding that we have of the history of the concept, that we were kind of pushing for it in Finland and trying to advance it to the global stage. Then we can discuss the core principles of the well-being economy. So I think we should start from the notion of GDP, because it's kind of more commonly used for or as an indicator for well-being. But I'm not sure if this is any news to anyone, but it doesn't really suit the function of measuring well-being in the economy. This was already kind of discussed by Simon Kuznets, who in 1934 published a report where he kind of advanced this idea and this indicator of GDP. And he said a few criticisms, but one of the major criticisms was that GDP doesn't really measure income distribution, for instance. So there's like this huge social lack in the concept. Like it tells you how much output there is in the economy, but it doesn't tell you like directly how it's distributed. So that's like one major downfall. And there's others, of course, like we can have a growing economy while we have more pollution and so on. So this is like the basic kind of starting point. So what the well-being economy does is that it puts well-being at the center of like kind of policy making, and it makes it an explicit goal, and it makes it something that has to be kind of focused on, and not just like economic growth per se, but like what happens when we grow, and like can we have also well-being without economic growth and so on. But yeah, I mentioned that the OECD published a report in, I think it was in 2019, if I'm not mistaken. And they define the well-being economy through these 4 notions or 4 parts, and maybe I will just quickly go through them. So according to the OECD, the well-being economy expands the opportunities available to people for upward social mobility and for improving their lives along the dimensions that matter most to them. Secondly, it ensures that these opportunities translate into well-being outcomes for all segments of the population, including those at the bottom of the distribution. So here you have, like you have social mobility and you have income distribution, you have the acknowledgement of poverty and so on. So it differs already from GDP to a wide extent. Thirdly, the well-being economy reduces inequalities, and fourthly, it fosters environmental and social sustainability. And there are different ways to define the well-being economy, but what I like personally is that you distinguish between 3 types of sustainability. The first is economic, then there's social, and then there's ecological. And at least in the Finnish context, what is usually said is that you should, in policy making, you should try to improve at least one of these types of sustainability without hurting the others. And I think it's a very good principle for policy making. Of course, it's not always possible. For instance, if you want to advance the green transition, for instance, it might mean that you have to kind of have more pollution in the short run to, invest in green production goods and so on. But like this should be at least the kind of main principle that you're trying to follow. And on the right-hand side, we have a figure called the donut economy. It's from Kate Raworth's book from 2017. And this is one way to introduce the idea of the well-being economy. So you have at the bottom of the donut, or at the inner layer, you have the social foundation, and you have to kind of hurt the nature or whatever to some extent to reach this social floor where you're meeting the basic needs, social needs in society, such as like food, health, education, and so on. Then at the outer part, you have the ecological ceiling. And when you overshoot that, then you have climate change and ozone layer depletion and stuff like this very bad outcomes. And between this foundation and ceiling, there is the space that Raworth calls the donut, which is kind of the space for sustainable society. And that's basically where the well-being economy exists and where it tells us to go. So then we have the question of how to measure the well-being economy. That's a very tricky question. I cannot give you a very good, precise answer right now, but there's at least 4 ways to measure the well-being economy, or in general well-being. First is to use these traditional macroeconomic indicators, such as the GDP, and we discussed that is perhaps not the best idea. Then the second option is to look at subjective well-being surveys. And one example is the World Happiness Report. And as you know, Finland has been the happiest country in the world for a while now. And then every year, everyone is wondering how is it possible, and who are the people who are actually responding to this survey. But yeah, so kind of the problem with this is that you can't really know if people have kind of all the skills and understanding of their own context to understand their own well-being. So yeah, this is kind of very basic criticism, but yeah, this is the issue. And in the graph on the left, there's the relationship between GDP, real GDP per capita, and then like these subjective evaluations of one's well-being. And we see that there's this nonlinear relationship, meaning that in the beginning, when you have a poor country and your GDP grows, then you will have more well-being or happiness, and then the effect will decrease as you grow more. But it just shows that there's not a clear relationship even between these 2 things. Then the third option is to look at a set of key indicators, and this is, I think, a good option. This is something that New Zealand, for instance, did for a while. And then the fourth option is to look at other macro level indicators. And I think this is something I think in general, we should use the third and fourth options and do them together. And here in this graph, we have one example of a macro indicator. So firstly, we have the blue line, which is real GDP per capita in Finland from 1960 to 2017. Then the pink line is this indicator called genuine progress indicator, which takes into account GDP, but it adjusts it to consumption or income distribution, and then to other things such as the amount of or like these kind of ecological losses and other social aspects. And what we see in the case of Finland, for instance, is that these two things grow together until 1990, and then they decouple, and our well-being actually starts to deteriorate as our economy grows. So this just shows you that we should use other indicators opposed to only looking at the GDP in order to have a fuller picture. But yeah, I have just the conclusions here left. So the first conclusion is that the well-being economy looks at these three types of sustainability and how they interconnect and try to improve all of them. The second conclusion is that we have different ways to measure well-being, and we should use the third and fourth options of measuring and look at them together. And then the third option is, or third conclusion is that the well-being economy is a very useful indicator for policymakers and should be adopted all around the world. Thank you very much.
Okay, thank you, Otto. I don't see any questions for you at the chat box, but I have one. So there's some kind of criticism against the concept of well-being economy, and that is, for instance, what is the added value of the concept if you compare that with let's say earlier concept like health in all policies? What does it add for the policymakers to help their decision making? Do you have any ideas on that?
Thank you. That's a very good question. I think in general these are not competing definitions, but they kind of help us look at these things from slightly different perspectives. But in our organization, we have actually used this synonymously with the well-being economy, this idea of having health in all policy. So I think they are pretty much synonymous, at least within our organization. What it just does is that it kind of emphasizes, I think, this is more kind of discursive, but it emphasizes that the economy doesn't exist outside of health and social aspects. And like this goes a bit beyond this talk, but like even in macroeconomic research, you see that like having bad social outcomes can actually decrease your GDP. And like if you have a lot of inequality and you don't have demand from abroad, for instance, then that can like hamper your growth within your own country. That's just one kind of crude example from the sphere of macroeconomics. But yeah, basically the notion of well-being economy, it underlines that the economy, it is central, but it is not just it is not the separate island in our society that we should kind of serve and try to maximize or whatever, but we should look at it as kind of being thoroughly and inherently interconnected with these other aspects of society and nature. Okay. I hope that responds at least partly to your question. Thank you.
Okay, let's hope that. So thank you, Otto. And let's move ahead. We have the following presentations by Caroline. So please, floor is yours.
Thanks a lot, Ilma. I will share my screen now. Yep. I hope you can hear me and see my slides.
We can hear you.
Okay, good. Thanks a lot for the invitation. I'm very happy to be here. I'm the director of EuroHealthNet, and for those of you who do not know us, we are a European partnership working on health equity and well-being, and we bring together almost 90 organizations across Europe, and our core members are national public health institutes such as THL, and also SOSE is a member of us. So it's very nice to be here. And we are actually based in Brussels, and we monitor European Union policymaking and try to advocate for health equity and action on the social terms of health. And our mission is actually based on two principles. One is that we want to address the root causes to health equity. Many people, policymakers, they see the ill health disease, and they think solutions are in tobaccos, alcohol, physical activity, diet reasons. But we know that, and the evidence also says that about 80% of the factors that make us sick are due to our daily living conditions, working conditions, and so on, as well as the underlying economic and social structures, power relations, and so on. The second principle that we use is that we think it's important to take a systemic approach towards reducing health inequalities, because everything is connected, and we need to do some systems thinking and use systems leadership, work with the community and policymakers from different sectors in order to find the solution towards reducing health inequalities. Not one solution, but very much a systemic approach here. We are facing quite some turbulent times. People are struggling with the very high cost of living crisis. We have demographic change, migration, aging of our societies, a climate crisis, obviously, and it's clear that we need to act comprehensively and see, okay, what do we need to do? How can we change our societies in such a way that we can address these challenges together? Because often it's the society or the economy that is the root causes to many of these interlinked crises. So we need indeed to have the shift in mindset to see how can we do things differently. And therefore we at EuroHealthNet, we find this well-being economy a very useful concept to link health promotion, disease prevention, and health equity into it, and to take that concept to different policymakers. We heard from SOS already, from Otto already, some more information about what it means. There are different concepts, different models out there on the well-being economy or the economy of well-being. I particularly like also the donut economy that Otto mentioned. It clearly shows how we shouldn't exploit people and to have the strong foundation, as well as not use more of the planetary resources that are actually out there, and develop this safe economy. But we also see from the past years that we are not doing well, and we are increasingly overshooting on those criteria, and that it is not going in the right direction. So what the mindset is, what we need to make people realize is that we are not here, the planet and the natural resources are not here to serve the economy, but it is the other way around. The economy is here to serve us. And that's what the well-being economy is about. And we see various principles and values that are similar across the different definitions of well-being economy and so on, because they all talk about the work upstream on prevention. We talk about doing this together with society, with everyone involved. We do this in ways that are just and fair, with dignity to everyone. We need to have businesses that are sustainable and working with nature-based solutions. The international community has embraced as well this concept. We see at OECD they have a center, it's called WISE, where they work on this topic. They also organize fora. There will be a well-being economy forum, the third one taking place in Reykjavik soon in May, which is supported also by the Joint Action Prevent NCDs. There is an alliance of the well-being economy with many partners actors, we are part of it, but also governments have formed a well-being economy alliance, and the WHO also is working on this topic. And if we see it, look at the EU level, it was indeed introduced by Finland when Finland held the presidency of the European Council in 2019, where they proposed a new long-term strategy for the Union reflecting the economy of well-being. This was then also supported by Ursula von der Leyen herself, stressing the importance to link to the Sustainable Development Goals and to deliver an economy that works for people and planet. I'll give two examples now of European Union policies that we are looking into as EuroHealthNet. The first one is the European semester. This is a very important economic policy process. It is an annual cycle where the Commission, let's say, checks the economies of the member states and makes some country-specific recommendations, and on economic issues, but also on social issues. And we have, over the years, we noted that some of the country-specific recommendations are really favorable and move towards health equity, but we see still that the economy prevails, economic growth over other areas, and also that the process lacks concrete well-being indicators. And this is, I think, also an area where we need to develop more work together. We published results from the various years of looking into the semester in this article in this scientific journal that you can download through this QR code. A second example is the European Beating Cancer Plan, which was launched by Ursula in 2020 as well. But unfortunately, we see that there are delays, serious delays. Even they may not. There will still be delays also in the upcoming future, unfortunately, on tobacco, alcohol, and food labeling. And here we see how the commercial determinants of health come at play, and the power relations also between the different DGs, DG Health on the one hand, but DG Trade, DG Growth on the other hand, and the industry. And I find it important to work on the commercial determinants of health, as that is an element of working on a well-being economy at the same time. No, if we cannot beat or tackle the commercial terms of health, then we are nowhere with well-being economy, and the other way around. So they actually, I find, go hand in hand. So what are some of the challenges to shift in mindset? The resistance to change generally, and particularly for the powerful actors that benefit from the status quo, but also people are used to do things in the way they do. I think we should also look critically at us in public health. Do we really want to work with other policy areas? Do we want to prioritize this? And how can we use this systemic approach and organize our work differently? The short-term thinking, of course, is the crisis today that needs to be solved. The political will, as we all know, is key, and I find it now increasingly more complicated due to the polarization that exists in society. It's more difficult now. It's the measuring of well-being, and in particular also the return on the investments. So if we invest in health and social and well-being, can we then demonstrate what the return is in monetary terms? How we work with other policies, align with other policies in a systemic way. It's a bit linked to health in all policies, also coming back to the question that Ilmo asked, but I think health in all policies is, I think well-being economy is more complex in a way. It goes beyond health in all policies, I would say, because it deals also a bit with this power relations between actors, and then various contextual sensitivities. We are now facing a new political landscape, as you know. Ursula von der Leyen is no longer talking about the well-being of planet and people, or the economy for planet and people, but it's about competitiveness, about defense, security, rearm Europe, and so on. But there are different policy hooks important to us. One is, for example, that the Commission wants to have a just transition to green and digital and so on. They have the competitiveness compass that goes across all their policy work, but healthy aging is actually mentioned. So there is some recognition that we need a healthy population in order to achieve competitiveness. There is a commissioner on intergenerational fairness. There's a consultation out there that you can respond to. There are still some quite some ambitious climate targets in the policy statements. There are plans to develop an anti-poverty strategy, an affordable housing strategy, and a new plan on a pillar on social rights. So there are policy hooks, and we need to advocate and be strong in saying that the well-being economy leads to a strong and secure economy. So these are my three calls for action for all of us in public health. First is we have to work together to shape this narrative for health, social justice, planetary issues and so on, linked to what are the priorities of today. So it needs to do some smart and thinking in communication. Second is we have to work with other sectors, because there is also where the innovation is, and deal with the power dynamics. Also thinking about the commercial terms of health in particular. And we have to continue to exchange good policies and practices, also looking at what are alternative funding models, because the funding for health and for doing this work will be more competitive in the years to come, and definitely support civil society, because they have a very strong role in making a well-being economy happen and work together. And it was Ilmo, and this is a publication we did with the Institute of Public Health in Ireland last year that sets out a well-being economy approach and more guidelines and recommendations. Thank you.
So thank you, Caroline. It looks like that you are still, let's say, at least hopeful regarding the policies of the European Union, even if there is this kind of let's say turn to a kind of rather traditional way of looking economic policies, competitiveness, and of course we are living the hard times. So what are you expecting? What's going to happen? Which side is going to win? And can you somehow, let's say, motivate us to continue the work for the better future?
Yes, I don't think this is about which side is going to win. I think we in society, we go up and down. Then we have a period with where sustainable development goals and all that is very high on the top of the agenda, and then we go through periods where that is not at all the case. I remember the Commissioner President Juncker. He had a mantra: less is more. And at that time, we were like, oh, health is going to disappear and all that, and then it came back. So it goes in waves. And therefore, I'm hopeful, not for the next 4 years, to be honest, but for what comes after. And for the next 4 years, there are policy hooks and there are opportunities for sure to engage with. And we need to do that. That's our duty and our responsibility to be there with public health, with our messages, and to help with other colleagues to shape an anti-poverty program or an intergenerational strategy. And I mean, we have those that work on these topics. We need to work together and make sure the current policies are maintained so that doesn't deteriorate, and then in better times we hope to go up again. Okay. Yes, so hopeful, yes, in a way, yeah, realistically hopeful.
Thank you, Caroline. Thanks. Then we move ahead again and go to York and Luigi's presentations on impact of the health systems and health to the sustainable development goals. Please, Luigi.
Thanks, Ilmo, for the invitation. I hope you can see my slides and also you can hear me. Okay, so my presentation is about how do health and health systems contribute to the Sustainable Development Goals, which was initiated and supported by European Observatory on Health Systems and Policies. And I think you have heard quite a bit today already about health in all policies, and that's we know what that means. It means that other sectors contribute to health, but health can contribute to other sectors. So what we try to do in this project is to isolate what we came up with this new phrase, which is health for all policies rather than in all policies. And again, this is not in competition with in all policies, but the idea was to try to isolate the effects that go from health and the health sector to other sectors, because often when we talk about health in all policies, then the focus on the health sector can be a bit lost. So in that sense, for once, we just said, okay, can we just isolate what health and the health sector can do for the other sectors? So that's why we decided to go for health for our policies. Now, when we were trying to think about these co-benefits from the health sector to the other sectors, we had to identify a framework, and the framework we thought was like useful is the Sustainable Development Goals, which already came up in the discussion already. So what we try to do is, so I'm an academic, so this is about trying to produce the evidence that suggests to what extent health can contribute to the other goals, to poverty, education, gender equality, growth, work, reduce inequality, responsible consumptions, and so on. So what we did was to contact some academics who wrote 9 articles that are all publicly available in this special issue in the health policy. They try to review the evidence of the co-benefits that go from health or health system to each of these sustainable development goals. So in my very few minutes that are left, I'll try to give you a brief summary of what this evidence suggests. And this is part of other initiatives where the European Observatory has done other publications. So I'm just going to focus on this one, which is the special issue on the co-benefit and the quantitative evidence. I'm going to spend a little bit more time on education. So the first article in this special issue, which is again publicly available, is how can health and health systems affect education. So Ines Lee, who wrote this review article, found 70 articles between 20 and 23 along many countries, and she nicely mapped all the evidence along 2 dimensions: in utero stage, neonatal stage, and childhood stage. And then our usual focus is to look either at health shocks or health system interventions and how this affects education. Just 30 seconds on methodological issues. We know that education affects health. That's not the link we are interested here. What we want to know is how health affects education. So, how health affects educational outcomes. So starting with the in utero health, there are several studies, for example, looking at how famines, wars, nutritional constraints, they all have been documented to have an effect on educational performance or cognitive test and so on. Or other studies, they look at the effect of health insurance and high school graduations, for example, in the context of Medicaid. If you move to the neonatal and infant health stage, there are lots of studies that look at birth weight, and they manage to correlate it convincingly in a causal way to education. So there is again lots of evidence suggesting that birth weight does affect educational outcomes. And then if you move to the childhood health stage, there are some health insurance expansions in childhood that again you can relate to educational outcomes in the short to medium term. You have WASH interventions in the context of low and middle income countries. You have breakfast programs, again, that have been linked to educational outcomes. So that's a brief nutshell of the article on education. There are many more. There is a different one on the effect of health on labor market outcomes. Again, here the authors, Pintor, Fumagalli, and Schurke, they wrote like a big overview, funding more than 100 studies. They again trying to link in a convincing way how health affects labor market outcomes. And out of these more than 110 studies, 67% of them, 2/3 of them, they find like a positive effect of health on labor market. And the kind of measures that they use is either the effect of self-reported health, chronic condition, whether they had cancer, malaria, mental health, on the usual labor market outcome indicators like employment probability, earnings, employment, and so on. So again, that's the second SDG. There are some clear effects from health so we showed that education and labor market outcomes, health affects both education and labor market outcomes. There is a third article that is specifically on poverty, written by Owen O'Donnell, and this was like a quite complex one to write, because there are many channels through which health and health systems can affect poverty. Two channels have already been covered. So the one on education and employment and earnings is one channel, but there is like a third channel, which is if you get ill and if you don't have insurance, then this will lead to medical expenses, out-of-pocket expenses, which can lead to catastrophic payments. So that's a quite distinct channel, and there are quite a lot of studies, which again is a separate literature, which tries to assess whenever countries expand health insurance, how this affects out-of-pocket payments. And some studies find that what you would expect, that out-of-pocket expenses reduce when insurance is expanded, but some other times you don't find that, and this could be due to the partial coverage of some of the schemes, and maybe health insurance coverage triggering additional healthcare and uncovering unmet need that can lead to other care that is not covered by the public package. So that's already 3 or 4 SDGs. There is one more that is dedicated on GDP, which came out in Otto's discussion quite prominently. So I think we are all quite familiar with what is known as the Preston curve, which is this diagram here that tries to link life expectancies with the GDP per capita. And we know that there is like a strong correlation there, that longer life expectancy is strongly correlated with the GDP per capita, though the curve is becoming less flat over time. But in which direction the causality goes is a little bit more tricky to identify. Is it the case that GDP increases life expectancy, or is it life expectancy that increases GDP? There are quite a lot of methodological issues out there. So I would say that here we have a strong correlation, but the causality is a little bit more difficult to nail down. Now, another SDGs that I think is quite interesting and important is SDG 16, which is peace, justice, and strong institutions. And again, we could map quite a lot of evidence there that shows how health can impact social capital and trust, political engagement and participations, and even a few studies on peace and conflict. So just to give you some hints, there are some studies that show that better health increases social capital, increases trust in other people, increases involvement in associations, and it goes in that direction, not the other way around. Also, health is quite correlated with political trust, which is quite different from trust in other people, and also improves voter turnout. And then there are just 2-3 studies that they show how more health spending or welfare spending can also reduce the probability of conflict or civil war, and more healthcare can reduce the probability of violence. Now, we also had the 2 other articles that are green. So the first one is on responsible meat consumption. So what we investigated in this article is whether if you reduce meat consumption based on a health ground, and that seems to be a plausible scenario, then this could have an environmental co-benefit. So if you can convince people to reduce meat consumption, especially red meat, which is the more polluting one, that could generate some positive co-benefits outside of the health domain. Now, the interventions to reduce meat consumption are the usual ones: educational campaigns, taxes, and regulation. But this can be quite difficult to implement. And so, although the link with pollution between meat consumption and pollution is quite clear, how to exactly implement these instruments is a little bit less clear, and how successful they can be. Another green SDG is climate change, and here the review by Zeynep Orr and co-author, they tried to show how health system can contribute to reduce emissions, and this can be done either through generic interventions that improve energy use, reduce waste, food waste, but also specifically to healthcare, reducing medical waste, greening medical practices, and so on. But then the other way to contribute climate change and reducing emissions is to make sure that we provide appropriate care. And there are lots of discussion in the health sector about inappropriate care. So if we could identify those areas and reduce inappropriate care, that this generates a co-benefit for the environment as well. There are two more SDGs, and then I'm done. So the one is on gender equality. So the article by Wong and Torbica, they reviewed again in a causal way how improved access to maternal care, contraception, and family planning can have an impact on labor market participation and educational investment through fertility decisions. And they also showed that there are a couple of studies showing how public health infrastructure can facilitate incident reporting in the context of gender-based violence. We also had a final article on healthcare financing. So the way you design a healthcare financing, the financing of a health system has redistributive properties. Some way to finance the system are more progressive than others. We know that tax-based financing system can be progressive if they are financed through direct taxation, but less so if they are financed through indirect taxation. Social health insurance system, they also are generally progressive, though some countries have complex ceilings and exceptions rule that can limit the degree of progressivity. And then we know from a lot of studies in the context of low and middle income countries that out-of-pocket payments can be regressive. So linking up with something that Caroline mentioned before, if you think about the return of investment of the health sector, it is not only if you invest in health through the health sector, this doesn't generate payoffs only in terms of health. This also goes beyond health and across many other SDGs. So I think that's all from me, and thank you for your attention.
Camera. Okay, so we had some technical issues here, which managed to fix, obviously. Thank you, Luigi. So you gave a really convincing evidence on the impact on health systems and health, or investments in health systems and the promotion of health to on other, let's say, good things in the world and the sustainable development goals. So have you considered any ideas how this convincing evidence could be turned to policy actions and convince also the politicians, policymakers, that investing in health is a good idea?
Yeah, thank you, for this great question. Yeah, I think in some way that's really the next step for us. Yeah.
Your mic is not on, or we don't have I don't hear you.
Okay.
I can hear Luigi.
Yeah, because my microphone is on. So
okay. So it was our loudspeakers, then they were off. So please.
Yeah, no, I think that's a really good question, and in some way that's how we are thinking about the next step. Now that we have all the evidence, we would like to integrate it, and ideally you would like to really calculate a return on investment. Now this is difficult to implement in different ways, because if you take just one specific interventions and you really want to map all these positive co-benefits, you need quite a lot of information. So one way to approach this would be to take like a case study of one policy intervention that is really quite convincing, and really try to calculate, to put all the evidence together and say, look, this is the difference between the rate of return where these co-benefits are included and where they're not. And then potentially over time, we could keep building, maybe develop like a database where we just keep calculating these returns on investment. So far we have only limited ourselves to provide the evidence that these co-benefits exist. I think it could be done that now we try to turn it into a return on investment, but this requires like a different approach because you would have to make a lot of different assumptions and computations. That would be one way to do it. A different way to do it, which is more qualitative, is just to collect, is just to provide like shorter documents that that provide some key messages that maybe is more digestible and could be disseminated in a much more wider way. So I think these are the two ways for the next steps. Thank you.
Okay, thanks. So in fact, do we have any questions, any additional questions from the audience? No, but there is a discussion by Caroline and Otto and Eva Ollila about the concept of the well-being economy. Do you have any, Caroline or Otto? Do you have any comments on that? On that discussion. We have still couple of minutes to continue that and broad these topics. Please.
Yes. Also, do you want? Yeah, there was a bit of a discussion on how can we stress the importance of the health and the social care sector as part of the well-being economy, and there are different ways of translating this. One is indeed about how we can have system change, that other policies. Investment other policies lead to better health, and the other way around is how can we show that investing in health and well-being is also an investment for the economy, because it's two sides of the same coin. But the third issue I think that was flagged up is what about the economics of health and care systems? That's a huge workforce. And whether we should use more of that into the well-being economy, that is, I think, an interesting one that we could also look into. And maybe Otto has more information on that as an economist.
Thank you, and thank you, Eva, for the very good question. If I understood correctly, you also asked about like the role of social services, for instance, and these kinds of services in the well-being economy framework. And I guess you have different kinds of ways of approach. I think I muted myself accidentally. Okay, but at least our organization, like we see social services, social security, and issues such as this, like kind of inherently connected to the framework of the well-being economy. And in your question, you already emphasized that like social services, they are connected to health, and there's this like kind of feedback loops. And that is something that I personally also believe. And yeah, social security is another issue. I think that is also included because the well-being economy is a kind of a coherent conceptual framework, but it's just a question of these kind of details. And I don't think you can kind of apply this framework easily to different countries, just like by not adjusting it. You have to look at the details more carefully because, for instance, in the genuine progress indicator, like you have volunteering, for instance, and free time and household labor, unpaid household labor in the indicator, but these things don't operate fully in the same way in different countries. So you have to kind of, it is my understanding that in the case of the GPI, for instance, in some cases you might look at volunteering work or unpaid work as a positive thing, and then in some other cases as a negative thing, depending on what is the kind of function and the role of that work in the system that you're looking at. So I'm again not sure if I fully responded to your question, but what I'm trying to say is that we have these indicators, and I'm looking at these things through the indicators, but the indicators are not kind of these they don't tell you the full picture, but you just have to adjust them based on your also qualitative understanding of the system that you're looking at and the country and the context and so on. But for sure, there are these feedback loops between social security, social services, and health, and also the economy, and that is what we are trying to do, to look at those connections.
So thank you. Thank you, Otto, Caroline, and Luigi, for your presentations, and for all of you. So all the audience, we have an opportunity to continue these talks in November at the European Public Health Conference, and so I welcome you all to come over and attend the meetings and the workshops and the whole conference at that time. So we have heard three presentations, introductions on concept of well-being economy. We have heard Caroline's very, let's say, positive, optimistic presentations. At least in the end, that the European public health policies and health policies they are developing in the future to the direction which are supporting the health, and also taking into account that part of the society, and not only competitiveness and security policies. And then finally we heard Luigi's let's say testimony on the scientific evidence that in fact when we are investing in health and health systems, we are also supporting the other goals of societies. So it's thank you for this. Then let's go to the future for a couple of minutes still, because this series of webinar is really going to continue. As I promised you to talk, mention something about them. There will be at least two webinars in the pipeline. So the next webinar is already on Friday, 16th of May, from 11 to 12 Central European time. And the topic of the webinar is a participatory research in action towards inclusive and ethical health policy and practice. That is organized by European Public Health European Public Health Association's Migrant and Ethnic Minority Health section, as well as the DHL. And in June, on 6th of June, there will be another webinar that is titled "Why is health not yet taken into account in all policies?" And that is organized by WHO Collaborating Center at the Tampere University, and together with Cancer Society of Finland, European Public Health Association, and Global Network for Health in All Policies. So mark these dates to your calendar, and so you also have an opportunity to get information from on these webinars on the website of the European Public Health Conference. So and then once more, welcome to Helsinki in November, and let's talk more about health policies and sustainable investments in health and health systems at that time. Okay, goodbye. Thank you all.
Bye bye. Bye bye.
Thank you. Bye bye.
Thank you.